Before entering my patient's room, I'm going to first gather my supplies. I'm going to make sure me and my patient are wearing a mask. I have my Foley kit, my stat lock, syringe, alcohol swab, a basin with soap and water with a dry cloth and wet cloth. I have my sterile gloves, my clean gloves, and the clean chuck that I have already placed under my patient. So I'll go ahead and enter the room, knock, knock, knock. Upon entering, I'm going to perform hand hygiene for a full 20 seconds. Good afternoon, Mrs. Jones. My name is John Michael Lozada, and I will be your student nurse today. Now, could I have you state your full name and date of birth? Jane Jones, March 10, 1994. All right, let me go ahead and scan your armband. Just give me 1 second. All right. All right, that matches. Now, Mrs. Jones, do you have any allergies, specifically to iodine, latex, or tape? No? Are you experiencing any pain at the moment? No pain? Very good. All right, today, Mrs. Jones, we do have an order to insert a Foley catheter into your urethra and bladder. And this will help you release the urine that you're retaining and will help relieve some of the pressure that's building up in your lower abdomen. Now, you may feel some uncomfortability throughout the procedure, but we're going to try to make this as painless and easy as possible. Do you have any questions or concerns about today's procedure? No? And have you had this procedure done before? Yeah? All right, very good. Let me go ahead and move our supplies off the table. I'm going to perform hand hygiene and don a pair of gloves so we can prepare our work area. All right, I'm going to start by wiping down the tabletop for a full 30 seconds. Starting now. Now, Mrs. Jones, before we start inserting the Foley catheter, I'm going to cleanse your perineal area or your genital area with some soap and water. And then after that, we're going to sterilize it with some iodine. All right, is that understood? Any questions or concerns about that? No? All right, very good. Okay, making sure to get all the edges. Okay, and dispose of that. I'm going to allow it to dry for a full 2 minutes. And while I let it dry, I'm going to make sure I close the door, close the curtain for some privacy. And then I'm going to doff my gloves. Or actually, first, I'm going to lay my patient flat in a supine position. Now I'm going to doff my gloves. This a little bit out. Perform hand hygiene. Don another pair of gloves. And grab my supplies. Place them on the table like so. All right, Ms. Jones, now we're gonna go ahead and clean your perineal area. Is it okay if I put down your blanket and lift up your gown? All right, thank you very much. Lift down your blanket, lift up your gown. And I did place a blanket on my patient's chest as well, so she remains warm. And I'm also going to spread your legs just a little bit. I'm going to bend them. Is that okay? All right, thank you. Okay, all right. All right, now with my basin, I'm going to grab the wet cloth that's already soaking in the soap and water. I'm going to wipe from front to back, the outer right side, the outer left side, and the inner. I'm going to grab the dry cloth, pat, 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 and pat it dry. Okay, now that we've done that, I can go ahead and doff my gloves now. Perform hand hygiene. Don another pair of clean gloves, and we can prepare our sterile field. Doing okay, Mrs. Jones? Doing good? All right, very good. to open the sterile field now. Making sure to only touch within a 1-inch border of the field. Okay. I'm gonna grab sterile gloves, put them off to the side. Grab our slat lock, drop it in. Grab our syringe, drop that in as well. Finally, I'll grab our alcohol swab. Drop that in. Alright, doff my gloves, perform hand hygiene, go ahead and put on our sterile gloves now. Again, making sure to only touch within a 1-inch border. And if it does look like the wrapper is touching my sterile drape, it's just the angle of my camera. My fingers are a little bit messed up, but I can fix that after. Fix the cuffs. Making sure not to touch my arm or drop my hands below my waist. Okay, I've already fixed the cuffs and the fingers. Pinch it in the middle, throw that away. Alright, now I can prepare my Foley kit. Grab the sterile drape. Alright. Alright, we're almost ready, Mrs. Jones. Let me just place this in between your legs. Alright, are you ready, Mrs. Jones? Yeah? Alright. Okay, I'm gonna, with my non-dominant hand, I'm gonna open up the labia. And we're gonna begin to clean the area with the iodine. So again, front to back. So left outer or right outer, one swipe. That's gone. Right outer, that's gone. One more. A little difficulty. Okay. And inner, one swipe, and that's gone. Okay, while not letting go, I'm going to now grab the catheter. And Mrs. Jones, I'm going to have you give me a good inhale on the count of 3, and then exhale, okay? So 1, 2, 3, inhale, and exhale. Okay, go about 1 inch, and I do see urine coming out. I'll go in about 1 inch more. Okay. So with my dominant hand, I'm going to continue to stabilize the catheter. With my non-dominant hand, I'm going to inflate the balloon. Like so. Okay, and that's gone. And now I'm just going to ever so gently tug until I meet resistance. Like that. Okay. Not too bad, Mrs. Jones, right? Okay, the sterile procedure is now over. I am now going to grab the alcohol swab and I'm going to scrub the hub for 15 seconds so we can obtain our urine specimen. Okay, full 15 seconds. You doing okay, Mrs. Jones? Yeah? Any pain? No pain? Very good. Okay. All right, I'm gonna allow that to dry. And it's already dried, so I'm going to obtain my specimen now. All right, that's over. Going to gently place the specimen inside, not too fast so it doesn't splash. That's gone. Okay, and then we'll label that and send it off to the lab. Okay, and all right, so now we can start to get rid of our supplies and we will stabilize the catheter with a stop lock. Okay. We will place it on your outer thigh right here. And I'm going to make sure to, about that, Mrs. Jones, place that back on. Okay. And I'm going to make sure to hang her bag below the level of her bladder on the side of the bed. Like so. Let's go ahead and get rid of our supplies here. Dispose of that. And then I'm going to put down your gown now, Mrs. Jones. Okay. And before I do that, let me go ahead off my gloves. Perform hand hygiene and don a new pair of gloves. You doing okay, Mrs. Jones? Good? No pain? Very good. Okay, no pain. All right. All right, so now that we have all those things in place, let me go ahead and put your blanket back on. You want to keep that blanket on your chest? Yeah? All right, very good. Okay. So I've already done all of that. Let me go ahead and place you in a lowest position, I'll put both your side rails up. I'll place your call light right next to you. If you have any questions, please don't hesitate to ask me. Let me go ahead and get rid of my supplies. We'll go ahead and send this off to the lab as well. Okay, gonna doff my gloves, perform hand hygiene once again. Okay, and upon exiting the room, I'm going to record the date and time, the patient's tolerance of the procedure, as Mrs. Jones experienced no pain, the size of the catheter used, and the description and amount of urine. The urine was clear or yellow, clear, no cloudiness or sediment. Thank you.